My lords, I thank the noble Lady Baroness Jenkin of Kensington for securing this debate. A timely update, a year on from the brilliant report of the noble Lady Baroness Cumberledge, as the noble Lady Baroness Bottomley of Nettlestone just said. Today's debate led me to look back over our debates around the Medicines and Medical Devices Bill, during which the government conceded, after Scotland had led the way, a Patient Safety Commissioner for England. We were then promised that serious consideration was being given to other recommendations of the report to support victims of disastrous medical procedures and prevent future avoidable damage. I follow the noble Lady Baroness Walmsley in pointing out that the victims of sodium valproate, pelvic mesh implants and Primodos are still waiting. The first Do No Harm report concluded thousands of lives have been ruined because officials failed to listen to female patients. I hope today we might perhaps on that issue hear some good news from the Minister. In 3 minutes, there are many issues I could cover, but I want to extend out the conclusions of the noble Lady Baroness Cumberledge to broader issues. Noting that women wait longer to be diagnosed for many conditions, including cancer, and that heart disease in women is more likely to be misdiagnosed. For a wide range of conditions, mental health is likely to be a diagnosis for conditions that have a clear physical cause, often only discovered after many years of suffering. I note too that intersectionality is sometimes deadly and always damaging play here, and that women from BA&E backgrounds and the LGBTIQA+ community are more likely to report poor treatment from their GP and to receive inadequate support from services. In the brief time left to me, I thought I'd focus on an area still getting far too little attention and something that's, like so many others, been exacerbated by the COVID-19 pandemic. That is musculoskeletal disorders. And I would like to point here the House to the excellent briefing for this debate from the Chartered Society of Physiotherapy, which covers that as well as many other important issues. And I feel like I should perhaps declare a personal interest here, having relied for many decades on physiotherapists to keep me going and repair damage wrought on both, I confess, the sporting field, but also in the workplace. As I read that briefing's recommendations on preventing musculoskeletal problems through access to occupational health physiotherapy, I thought of some women who I met in Sheffield working at picking baskets for a major supermarket's home delivery service, from midnight to dawn, hearing from them how physically challenging it was and how tough it was in the chiller and freezer sections. And of course, we have to think about the many women who are doing what is often a double shift in the home and child and elder care, where women also suffer musculoskeletal damage and would greatly benefit from musculoskeletal first contact physiotherapists in primary care being available to all. Thank you, my lords.